So my name's Andrea Silvas, and I am a MedPeds intern. And what do I love about this program? Well, I think from the beginning, it's just been amazing support. I think that's been the first thing that stood out to me. I struggled a lot with just like increasing anxiety when I first started the program, and just like from the beginning, everyone just like wrapped themselves around me and provided me with like all the opportunities that I needed to be connected to like mental health resources and everything that I absolutely needed. And so that's been probably the thing that has stuck out to me the most, just the amount of support and love and like affirmation and just like I am not alone in this place at all. And it's been absolutely amazing. Jumping to like, what do I love about the EBMC clinic? Well, I am a Spanish-speaking physician as well. And I think I've seen maybe 2 patients in English since I started residency, and not that we don't have patients who speak English, but I specifically very much wanted a panel with Spanish-speaking patients, and so it's been a huge home for me to be able to go to clinic where I see a bunch of patients who speak my first language and connect with them at that level. That's been incredibly amazing, and they are patients that come from many different countries, many of them undocumented and uninsured, and I just feel my med school was in El Paso, and which is at the border of Mexico and United States. So it was like kind of a similar situation where there was a lot of undocumented and uninsured. So I just, like I said, I feel like I'm back at home and I'm able to connect with patients at such like a deep cultural and like personal level. And that's been absolutely amazing. Do I feel integrated to both programs? I absolutely do. I started on the ped side, and that's sort of when I started having a lot of struggles with like anxiety and just like mental health and panic attacks. A lot of that happened on the ped side, and all of the chiefs on that side are like currently my heroes, and they're absolutely amazing. They took me in, and they were the ones who like super supported me when all that was happening. And so yeah, from like the attendings, like I feel like they really reached out, and like I have so many of their numbers, and they've been able to reach out and definitely feel integrated, connected, and accepted on the ped side. And like recently just came over to the medicine side, and I already feel like I'm part of the family, from the chiefs or like the senior residents and all of the different residents that are on this side. I already am excited to keep working with them, and I'm like sad that I'm not on the ped side, but super excited to be on the medicine side. So I think it's just like a really great combination to be able to see such wonderful people on both sides. So definitely very excited about that. I'm not at all from this area. I'm actually from like West Texas, from El Paso, and that area is very much a desert. So Baltimore has been amazing because there's like so much green and it rains here often. And I think that's just been really exciting for my husband and I, because there's like random tomatoes and squash growing in our garden that we did not at all plant. And so that's been like very pleasant to see. And Baltimore is full of life, like everywhere. We live in Hampton, so sort of like North Baltimore, and there's like tons of shops and little places to eat, and there's also yummy, and you can walk everywhere. Like I feel very safe running from my house. Like yesterday, I went for like, it was like an hour that I was out with my dog running, and I felt very safe.
Hi everyone, my name is Bernard Rizal. I'm a second year internal medicine resident here at Johns Hopkins Urban Health. And when picking at programs for internal medicine, my husband and I picked Baltimore and Johns Hopkins Urban Health for a few reasons. First of all, Baltimore is a cosmopolitan place, and for us, my husband is British and I is Filipino, we are close to many cities in the East Coast, particularly like New York, Philadelphia, and that sort of encouraged us to come here. And Baltimore is not too big of a city, it's not too small either. Just to give you an overview, the core rotations here is very unique in the country in that we are provided with a lot of opportunities. For example, last year I was doing a women's health rotation, and next year I'll be doing adolescent medicine. We also do like addiction medicine, and currently I'm doing HIV and hepatitis C.
My name's Edward Cordy, and I'm an intern in the MedPeds Urban Health Program here at Johns Hopkins. What I really like about our MedPeds program is that it's integrated really nicely into both of the categorical programs, but then at the same time we have our own identity. And in particular, the MedPeds Urban Health Program has, I think, a special identity where all of the residents have shared interests in urban health primary care, which makes for great discussions all the time. Well, for me, it really was the opportunity to rotate through places like incarceral health, HIV clinics, hepatitis clinics, and have those added aspects to a MedPeds program that maybe I wouldn't have found at other places. My personal favorite part of the program so far has been the clinic at East Baltimore Medical Center. There we care for the entire age span, so I will have a newborn exam, and then the very next patient could be a 75-year-old with several chronic diseases. And it's exactly the population that I was hoping to care for, and I absolutely love it there.
Hi, everybody. I'm Will Roberts. I'm an urban health internal medicine intern. And what I love so much about the Hopkins Urban Health Internal Medicine program is, it's a big number of things. I'd say first and foremost is just the amount of support, the challenge in the environment that allows me to grow to who I want to be, and just the overall vision. Yeah, so one thing that's really, relaxed me this intern year is, it's been a hard experience in a transition, but being in an environment where, there's really a group of people that's supporting me and letting me know that, I can get through these challenges, and knowing that I'm always, safe in the decisions that I'm making, it's really been something that's been comforting in this really, hard beginning journey so far. And thinking about the urban health program as a whole, something that really drew me to this program was the ability to think about the community in the context of all the social issues that that are part of it. I'm really a big proponent of thinking about medicine, just in the context of the communities that we serve. And a lot of times we might think about an individual, their disease, and not necessarily about where they came from, what are the sort of reasons why they have those type of things. And this program really focuses on a lot of those social aspects as well, and they give us the opportunities to go in the communities and learn about a lot of these issues and the root causes, because there's so much of medicine outside of just what's happening in the clinic, what's happening in the hospital. And I appreciate this program's ability to make us think in that lens. So even though I've only started for a couple months, I'm so excited for what the rest of the year has to hold, because I'm with the right people, with the right mindset, and it's just been great so far.
Hi everybody, I'm Ross Gilbert. I'm one of the MedPeds interns this year. I just moved to the Baltimore area from Milwaukee, Wisconsin. I was born and raised in Wisconsin. Moved with my wife Deanne and my 1-year-old daughter Celine. So things that I like about Baltimore so far, this is my first time living on the East Coast, and I was actually very pleasantly surprised with how welcoming and kind people are. We've already made a bunch of friends with our neighbors, and it's just a welcoming city, and feels like a smaller city. There's kind of the neighborhood feel, and it's just a great place to live. I think things about the program so far that I've appreciated the most is it's really nice to be surrounded by a group of colleagues who think about medicine the way that you do, who deeply care about their patients and about their colleagues as well. Always thinking about the underlying reasons of why they're in the hospital, what got them to this point, and how we can keep people healthy and outside of the hospital. I think our colleagues are incredible. They're all incredibly impressive. We have a great group of residents here in the MedPeds program, and I'm continually kind of in awe of my colleagues, and it always feels like we have really big shoes to fill from the upperclassmen. They just are all really incredible doctors. And I have already grown very close to my intern class as well, so there's definitely a huge sense of community. In planning to come here with a family, there were a lot of things that I had to figure out before even moving to Baltimore. Things like childcare, who was going to be my daughter's pediatrician, what kind of things we were going to have in place before we even moved to Baltimore. And the leadership was really good about directing us in certain ways and helping give us recommendations for how to get stuff established before we got here, since that was really important for us. So all in all, I feel like this program does a really great job of setting you up with a group of people who really, truly care about the social determinants of health, care about health equity, and about moving population health forward in terms of preventive care and making our hospital systems and our healthcare system more friendly to patients.
Hello, I'm Rohini. I am a second-year resident in the Internal Medicine Urban Health Program. I am originally from Nashville, Tennessee, and while I was there, I was very involved in our student-run free clinic, where I learned that we can only do so much as doctors in terms of taking care of our patients, and so much of their lives is determined by things outside of our control, like how much food they can eat, or whether it's healthy food or not, how close the grocery store is, whether they have transportation to get their medications. So I'm very interested in getting insurance companies to pay for social determinants of health. So I picked the Urban Health Program because of the alumni network. Everyone that I have seen here is doing something that I would want to do in a future career. So the graduates are doing everything from working for the Indian Health Service to creating protocols for how to treat people who have substance use disorder, and having access to that after graduation is going to be really important, just in terms of having them in our friend circle and also as potential career opportunities down the line. I remember receiving my match day envelope and being absolutely terrified, first and foremost, that I was coming to the Osler Hopkins Residency Training Program. Definitely had a lot of imposter syndrome the first couple of weeks. And what I have learned since then is that the people here are super kind, friendly, willing to let you learn. My very first day on the rounds, ACS rounds, I was pimped on an EKG very formally. And what I remember about that experience is not like how scary it was, but it was the fact that my co-interns were actually cheering me on through that experience, being like, you did a great job finding the QRS.
Hi, my name is Janiqua Caesar, and I am a second-year internal medicine and pediatrics resident within the Urban Health Program. So for me, when I first discovered the program, I immediately fell in love with the concept, with the idea of the urban health curriculum, and I was head over heels. I ended up coming to do an away rotation, so there's a visiting elective for pediatric students, and initially I was really intimidated. I thought that this place would be filled with people who are really brilliant but can't connect, and people who could maybe be a little bit mean and maybe not as forgiving when you didn't know things. But when I came here, I experienced the complete opposite, and I was blown away. So within the elective, I got to meet so many people. I met leadership, I met faculty, I met other residents, and everyone was just so welcoming, and everyone was so kind and so brilliant and really passionate about providing great care for the patients. And I think that's what sold me. And I think that's been holding true for my first year here. I still feel the exact same way. I haven't actually ever felt so supported by an institution. I really believe that people are there for me whenever I need them. I feel supported by our program directors and by the APDs, and I can text them, I can ask them any questions at any time, and they're just always there to offer a helping hand. And my co-residents are incredible people. They are really just so brilliant and so passionate about what it is that they're learning. They're all just lifelong learners, which is a really cool environment to be a part of, to be with people who are always challenging you and always wanting to know more, and not just for their own knowledge, but so that they could really provide excellent care for their patients. And our patient population has been wonderful to work with too. So we're at East Baltimore Medical Center, and I like that it's kind of off of the Hopkins campus. It's cool to kind of be more in the community, and it's been really sweet to collect families. So I'm Med-Peds, and so I've met people in the hospital, and then I've recruited them to come and see me at clinic, and then sometimes they'll bring their mom along too, and then I'll recruit their mom, or they'll bring their children, and then I'm caring for the entire family. And so I really like that, since I want to go into community medicine and be a primary care physician. It's been a really great experience to be able to do that, and to be able to get to know people, and we've had pretty good continuity where I've seen people multiple times throughout the year, and so I feel like I've started to build some relationships with them, and know how they're doing, and know like kind of what's going on in their lives, and get to know them a little bit better, a little bit more intimately. That's been a really wonderful experience too. Yeah, and so on the interview trail, people are always saying, oh, it's the people that make up the program. I chose this program because the people here. And I never really bought it, and I didn't really get it until I met the people here, and then being here has constantly reaffirmed that. I really feel like I'm just here like in the best place with the best people, and coming here, like I mentioned, could be a little bit intimidating because Hopkins and its name and its prestige. But when you get to it, it's really just filled with incredible people who love serving others and who want to be the best at what they're doing. And it comes from like an intrinsic motivation of love and of compassion. I wouldn't imagine it any other way. Like I would choose this program 1,000 times over.